Toledo. 13 Action News starts now.
More deadly drug combinations are being found in Ohio and across the United States. It's an increase that law enforcement agencies are warning could result in more overdose deaths. Deadly drug mixtures is our big story today. Right now, Ohio Attorney General Dave Yost is urging caution. That's after new data shows an increase of drug seizures involving carfentanil and other deadly opioids across the Buckeye State. So far this year, Yost says forensic scientists at the Ohio Bureau of Criminal Investigation have identified carfentanil in 199 items submitted to the Bureau's lab for testing. Now, if you look at this map, you can see the 46 counties where carfentanil was detected. Some of the counties with the highest presence of the drug include Franklin County with 31 seizures, Delaware County with 17, Fairfield with 13, and Allen County with 11 so far this year. There's also an increase in carfentanil being found in our area, with at least 9 counties across Northwest Ohio reporting the drug being seized by law enforcement. 13 Action News anchor Alexandria Manthe joins us live in studio to talk about those numbers here at home. New at 4:30. Alexandria?
Yeah, Tony, this new data shows several law enforcement agencies in Northwest Ohio have seized carfentanil and other deadly synthetic opioids this year. Now, according to this map, so far there have been 2 cases in Lucas County, 4 in Wood, 1 each in Fulton, Defiance, Hancock, and Seneca counties, and then 4 over in Sandusky County. Carfentanil is not a new drug. Its presence in Ohio actually peaked in 2017 when the Bureau of Criminal Investigation found the substance in over 1,100 samples that were tested that year. Carfentanil is a synthetic opioid developed for veterinary use to tranquilize large animals such as elephants. It's not approved for use in humans. Yet, local recovery experts I spoke with say they're seeing their patients use this drug thinking it's fentanyl. But authorities say carfentanil is 100 times more potent than fentanyl and about 10,000 times more potent than morphine.
So I don't think people specifically go out to find carfentanil to use. They go out because they're addicted to opioid and they want to use whatever is available to them. And so sometimes they wind up getting carfentanil and they OD on it.
Dr. Anthony Boyer, who you just heard from, is with New Concepts Toledo. He says that he's constantly hearing about new drug compounds, suppliers mixing fentanyl with something else, which could make the drug even more potent. I'll have more on that coming up on Action News at 5:30. Tony.
Alexandria Manthe reporting live for us this afternoon. Thanks. Ohio law agencies also warning about a new polydrug mixture that's hitting the streets. It's called purple fentanyl, and police say it's even deadlier than fentanyl. Reporter Mike Mason has more about this new threat.
Reports of purple fentanyl are now popping up all across the Midwest. Users being misled into believing that purple means pure.
Supposedly it gets a higher increased high.
Major Heath Tester heads up the drug task force at the Lorain County Sheriff's Office. He says dealers are cutting this new form of fentanyl with a local anesthetic.
They're mixing it with lidocaine, the fentanyl with the lidocaine.
Lidocaine is easily obtained and often prescribed in patches for back pain. But it's also transforming an already deadly drug into a much more potent killer.
The Narcan has a reverse effect on it. It's not bringing them back because of whatever the lidocaine is. The mixture of that is countering with the fentanyl.
The DEA recently posted these photos of purple fentanyl bricks they seized along with bags of purple and orange pills. They say purple fentanyl comes in several other forms, including powder and blocks that look like sidewalk chalk. So far, it's shown up in Michigan, Missouri, and Nebraska. While none has been reported in Northeast Ohio, law enforcement says it's just a matter of time.
Here again, now we've got to learn how to stop this.
That was Mike Mason reporting. The purple color is thought to be a marketing ploy by drug dealers. It has nothing to do with the potency of the drug. Authorities still advise you to use Narcan if you suspect someone's overdosed on purple fentanyl, because fentanyl is the active ingredient and Narcan may help. The United States is seeing an increase in people mixing drugs. According to the Alcohol and Drug Foundation, there are many reasons why someone would mix drugs, including to enhance the effects, to compensate for the negative effects of one drug by taking another, or they're substituting a drug choice for an alternative polydrug. Experts warn it's difficult to predict the effects of polydrugs and that taking multiple drugs can increase the impact on the brain and the body. A new study by Boston University's School of Public Health finds kids as young as 15 are using multiple substances combined with opioids. The study examined trends in overdose deaths from 2020 to 23. It finds polydrug overdose deaths occurred among kids as young as 15 years old and rose steadily with age. The study also finds fentanyl and other synthetic opioids were involved in more than 93% of overdose deaths. And stimulants such as methamphetamines and cocaine were the primary contributors to drug mixture deaths. Researchers also point out several likely factors for the increase in polydrug overdose deaths, like wider availability of illicit drugs, rising potency of drugs, and worsening mental health challenges. Happening tomorrow, local law enforcement agencies are getting ready for the 29th annual National Prescription Drug Take-Back Day. This is tomorrow from 10 to 2. The day allows and encourages you to safely dispose of any unnecessary, expired, or unused prescription medications. There will be nearly 4,000 collection sites across the country, including several in Northwest Ohio. To find the drop-off location closest to you, check with your city's police department or visit DEA.gov. This is a developing story. Stay informed.